Alright, welcome to our scene on osteoporosis, represented by this guy over here who's really scared because he walked into his anatomy lab and he realized that someone took roses and put them into the skeletons. We'll call these skeletons the osteos because osteo is bone. So we'll call these the osteoroses for osteoporosis. We're going to talk about all the different features of osteoporosis as well as treatment at the end. So let's begin. Take a look at this picture on the wall over here. It shows the trabecular bone and the cortical bone. Osteoporosis is when there's loss of bone mass in the trabecular or the cortical bone, which is the hard external layer. So there's going to be higher breakdown of the trabecular and cortical bone in comparison to the formation of new bone. And this leads to an increased risk of fracture. But the thing with osteoporosis is that lab values will be normal. That's why we have this sign on the wall over here that says normal lab. Now you and me both know that this is not a normal lab. But the normal lab over here is going to remind us that lab values are normal. Serum calcium is normal, phosphate is normal, bone mineralization will be normal. This is as opposed to like in osteomalacia, where lab values would not be normal. Okay, what are the causes of osteoporosis? For that, we need to take a look behind this boy over here. So he's so scared that he doesn't even realize that there's an ostrich exercising behind him. Well, it's ostrich at the gym. Ostrich at the gym for estrogen. And the reason why the ostrich is really small is to help us remember the estrogen is decreased. Decreased estrogen can lead to osteoporosis. For example, a woman post-menopause. And this is because estrogen is important for inhibiting bone resorption. So without the estrogen, bone resorption will be favored. Next to the ostrich over here is this old man. The old man for old age. Old age is also a cause of osteoporosis. It is thought that the reason for this is because when a person gets older, their osteoblasts don't work as well, but their osteoclasts remain to work well. Osteoclasts break down bone. So bone will be broken down, but will not be formed as much. The old man is next to this lady over here who's anorexic. Anorexia is also a cause of osteoporosis. And he's holding this beer over here. The beer reminds us of alcoholism. Alcoholism can also lead to osteoporosis, as well as other drugs, represented by this drug bottle. The drug bottle is going to remind us of the drugs. Osteoporosis can be secondary to drugs, such as steroids, anticonvulsants, anticoagulants, and thyroid replacement therapy. Or it could be secondary to other conditions. Here we have the parrot who's hyper for hyperparrot. Hyperparathyroidism and other conditions can also lead to osteoporosis. There are so many of them, we'll just make mention of them. Turner syndrome, diabetes mellitus, Cushing syndrome, hyperthyroidism, and multiple myeloma. Okay, before we take a look at this x-ray on the wall over here, let's take a look at this ad that someone put on the wall of the lab. 2.5 men. This is going to remind us of a value that we need to be aware of. 2.5. Actually, negative 2.5. We'll remember negative by the explosion. Negative 2.5. Negative 2.5 is a value you want to be aware of. And that's because it's associated with the DEXA diagnosis test. Here we have the discs over here for DEXA. So let's explain. Osteoporosis is diagnosed by bone mineral density measured by DEXA, the dual energy X-ray absorptiometry. And this is done at the lumbar spine, total hip and femoral neck. So if a person has a T-score equal to or less than negative 2.5, that's diagnostic of osteoporosis. And it's important to remember that a one-time screening is recommended in women who are 65 and older. Okay, let's take a look at that X-ray. So osteoporosis can lead to fractures, most commonly a vertebral compression fracture, in which one or more bones in the spine get weaker and shatter. This presents with acute back pain, loss of height, and kyphosis. It can also present with fractures of the femoral neck and the distal radius, although these are most associated with postmenopausal osteoporosis. Okay, let's talk about prophylaxis and then we'll talk about treatment. And for that, we need to go to the second floor. So take a look at this cheese bench pressing. This cheese bench pressing is going to remind us of prophylaxis for osteoporosis. So the bench pressing for weight-bearing exercise. This is important for increasing bone mass. The cheese, well, cheese is high in calcium. Cheese in our videos represent calcium. Calcium intake throughout adulthood is important for preventing osteoporosis, as well as vitamin D intake, represented by the D that he's trying to bench press. Okay, let's talk about treatment. Treatment is represented by this part of the room over here. The first thing we note is this blue fossils on the floor, the blue fossils for bisphosphonates. Bisphosphonates, such as alendronate, are usually given for treating osteoporosis. In more severe cases, we have this pear guy over here on top of the tide that's about to wash away the blue fossils. Perontide, or the terrible perontide for teriparatide. In front of this whole thing over here, there's the rabbi giving the sermons. He's giving sermons for SERMs, S-E-R-M-S's. He doesn't even realize that there's this dinosaur standing on top of the map that's about to bite him, I think. dinosaur on map for denosumab, which blocks osteoclasts. We're just going to make mention that rarely calcitonin is given, because calcitonin opposes PTH, promoting bone formation. Okay, I hope you enjoyed this scene on osteoporosis. Please subscribe to our channel if you haven't done so already, and take care.